Bonjour tout le monde, je suis Linda Silas, présidente de la Fédération canadienne des syndicats d'infirmières et infirmiers. La conférence de presse ce matin sera en anglais, mais si vous avez des questions ou commentaires en français, ça nous fera un plaisir de les répondre. Good morning, everyone, and thank you for being here. I'm Linda Silas, president of the Canadian Federation of Nurses Union and a proud member of the National Pharmacare Committee of Experts with Dr. Nav Persaud and Amy Lamb. We are holding this press conference 1 week after the tabling of our final report to make one message clear. Our work is not done. We have long advocated for national single-payer pharmacare, and our report is an important milestone. But the recent federal budget gave no sign of expansion of C64 is coming. Meanwhile, millions of Canadians face the impossible choice between paying for medication they need or paying for their rent. After months of consultation, we put forward 8 clear recommendations that shows the federal government how to move forward to deliver essential medication through an equity lens. Before I invite my co-committee members, I'd like to recognize that we are here on the unceded territory of the Algonquin and Anishinaabe people. So now it's my pleasure to introduce our chair, Nav Persaud.
Thank you so much, Linda. As a family doctor, I take care of people who cannot afford life-saving medicines. Treatments for diabetes, high blood pressure, schizophrenia, HIV/AIDS are priced out of reach for millions of Canadians. So people die because medicines are excluded from Canada's publicly funded healthcare system, despite multiple recommendations to implement Pharmacare. Progress on improving access to medicines is reported by Canada to the United Nations as part of Canada's efforts to progressively realize the right to health. Canada recognizes the right to essential medicines through being a party to international treaties and through supporting international efforts to provide essential medicines to people in other countries. Yet progress here has been slow because each dollar that's saved through Pharmacare represents a dollar less in potential profits. That means there's 4.6 billion reasons to implement Pharmacare. The most important one is to save lives and protect health. Public support for including medicines in our publicly funded healthcare system is consistently above 80%. Governmental reports from 2018 and 2019 clearly made the case for bringing medicines into our publicly funded healthcare system. Pharmacare is one way to help make good on promises made by the Crown to Indigenous peoples dating back to at least 1876 with the Medicines Chest Clause of Treaty 6. The government has committed to reconciliation through the United Nations Declaration on the Rights of Indigenous Peoples Act. Here's what should happen now. The federal government should fully fund access to essential medicines for everyone living in Canada. An independent body should use international best practices to maintain a list of essential medicines as part of a coherent national strategy. Competitive processes like tendering should be used to lower the prices paid for medicines. Progress on improving access to medicines should be reported annually to the United Nations. Most of the best medicines are old. These include anti-infectives, treatments for high blood pressure, treatments for depression and schizophrenia, as well as other life-saving treatments that were discovered decades ago. While difficult decisions may lay ahead regarding new and expensive medicines, we can immediately provide free access to many effective medicines at a relatively low cost and within a set budget. In the future, the list of covered medicines can expand using international best practices and precedents that balance limited public resources and the right to health. The first step is passing new legislation that builds upon the principles of the Canada Health Act: public administration, comprehensiveness, universality, portability, and accessibility to include essential medicines in Canada's cherished publicly funded healthcare system. Legislation that does not rely upon bilateral agreements should be advanced with the urgency appropriate for access to life-saving treatments. Our recommendations meet current challenges. To whatever extent American tariffs inflate medicine prices in Canada, savings from Pharmacare will increase or magnify. The need for Pharmacare will grow if trade war casualties lose their jobs, and with them, their employment-based, privately administered insurance plans through our current American-style approach to private insurance for medicines. There has never been a better time to implement Pharmacare. It's now my great pleasure and honor to introduce Amy Lam, the Executive Director of Indigenous Pharmacy Professionals of Canada.
Thanks, Nav. Thanks, Linda. In the 20-year history of the Pharmacare file, I was the first ever pharmacist appointed to a reporting committee. Although engagement with the pharmacy sector has occurred, it has been rooted in criticism of Pharmacare's projected disruption to the complex and nuanced industry. Drug pricing impacts the entire pharmacy sector, in part due to the transactional models that tie drug costs to safe and effective delivery of medicines. This committee acknowledged the importance of pharmacy systems oversight to ensure that there's no risk to pharmacy distribution, operations, or professional services while meeting standards for the safe delivery and distribution of drugs. We identified that drug pricing impacts dispensing, distribution, and innovation sustainability, and that this vital infrastructure requires adequate and evolved funding to be implemented for the success of the Pharmacare program. Innovations and relationships have built robust drug supply systems in this country. Still, as one who works to evaluate and address health systems and programs that undermine health equity, even our best system innovations are falling short, particularly towards fiscal and environmental sustainability, equity, and data-driven utilization. Pharmacy distribution and services are failing to serve remote and rural communities in one of the most geographically remote countries in the world. Drug coverage does not necessarily translate into improved access to medicines, but the report acknowledges that vital stakeholder guidance in developing sustainable reimbursement models and program evaluation frameworks with an emphasis on the existing gaps, equity-deserving populations, and underserved geographic regions. In the absence of Pharmacare, policies and disruptions from other countries substantially impact our drug pricing and supply chains. Health economists and international models have exhibited that our mixed payer dominance limits oversight and leads to excessive inefficiencies in drug spending. Lack of data and transparency in these mixed models hinders progress towards best practices, planning, and risk management. Two key barriers have stalled the implementation of national Pharmacare and the realization of benefits for intentional and harmonized drug spending. This includes federal-provincial disputes over jurisdiction of health delivery or unwillingness to collaborate on shared costs, and the skepticism about the projected savings from Pharmacare within these complex drug supply systems. Critics suggest the program will fail to achieve improved drug pricing or, in doing so, harm medicines access. We sought to affirm that the program could be established to test, evaluate, and adapt for these antagonistic projections, and that it represents significant value in other ways. Federal investment in Pharmacare represents a co-creation framework, a national medicine strategy, Canadian-made prescribing guidelines, Canada-owned health data, environmental impact efficiencies, and investments to navigate supply chain disruptions in an increasingly geopolitical and environmentally unstable world. This program will change soaring drug expenses into a sustainable health systems infrastructure with the perspectives of rights holders, systems leaders, and best practices to build, evaluate, and inform the iterative delivery of the program. As a Métis woman, Pharmacare's impact on Indigenous health was top of mind. The committee's consultation with Indigenous health policy experts cannot authentically speak to the needs of Indigenous peoples. It affirmed the need for Indigenous-led and determined drug coverage reform. Pharmacare must not disturb existing nation-to-nation relationships, impact Indigenous health budgets, or be implemented for Indigenous peoples without their consent or evaluation. Pharmacare would supplement drug coverage gaps for Métis peoples and non-status First Nations. The federal investment will reduce drug costs to provincial governments and to federal drug programs, with an opportunity for savings to be applied to their population's distinct needs, and advancing Indigenous determination on savings to the non-insured health benefits program. The Pharmacare Committee of Experts report describes a nation-building investment purposely constructed from Canadian-made principles and co-developed with the system's participants and recipients. If authentic engagement and participation occurs, the value of drug pricing will be undeniable, as it will represent medication access, equity, sustainability, and control, universally shared with all living in Canada.
First, on behalf of the committee, we'd like to thank the Honourable Mark Holland for appointing us on this committee. It was a nice year to spend talking about Pharmacare. So as you heard, the evidence is clear. We need to reform how we distribute, how we access prescription medication, and it is urgent. This affects everyone in our healthcare system. It affects patients, families, providers, communities, and the long-term sustainability of our public healthcare system. The committee of experts spent months reviewing the best models in Canada and around the world. Our goal was really simple: to chart a practical, equitable path forward for the federal government in partnership with the provinces, territories, and stakeholders, a path that we could act right now. It resulted to 8 recommendations that brings clarity and directions to the future of Pharmacare. So I'll go over them briefly. If you want paper copies or electronic copies, we'll make sure that they're attached to the press release. First, the federal government should move quickly to pass legislation that recognizes the right to essential medicine and clearly define universal first dollar single payer coverage through a publicly administered plan. Second, the federal government should fully fund the national list of essential medicine. No need for more bilaterals. Third, we recommend creating an independent body responsible for maintaining that list and ensuring it reflects the best evidence. Fourth, we call on the federal government to develop a national essential medicine strategy focused on affordability and accessibility. Fifth, the initial list of essential medicine must be fully funded and implemented without delay. 6, Indigenous people must be at the forefront of monitoring and evaluating an evaluation plan to access the impact of Pharmacare on access to medicine. 7, the federal government should work directly with the province, territories on a concrete plan to improve primary health care and pharmacy services to support Pharmacare implementation. And 8, data on health outcome and prescription pattern must be collected and acted upon quickly, with an annual reporting to the United Nations on action Canada is taking to realize the right to health. These 8 recommendations gives the government a realistic, actionable blueprint. It is a practical plan that will help millions of people and strengthen our healthcare system for decades to come. We are here today because we know what is possible, we know what needs to be done, and we know who will benefit: every person in Canada who relies on medication to live a healthy, safe, dignified life. Merci beaucoup, and we'd be happy to answer your questions now.
Merci, on va y aller avec les questions. Il n'y a aucune question sur Zoom dans la salle. Are there questions in the room?
Sarah Ritchie with the Canadian Press. Nice to see you all. I wonder if you can tell me what your meetings this week on the Hill have been like.
Sure. First, I'll start by saying we're grateful to the Minister of Health for the opportunity to provide advice on an important issue like Pharmacare. Our report was submitted to the Minister of Health, and we understand that the Minister of Health was briefed by her staff. We've had positive meetings with members of Parliament who expressed an interest in Pharmacare, including members of Parliament who have worked on the Pharmacare file for years, and I believe including those who were involved in discussions about the 2024 Pharmacare Act. And what I heard is a desire to move forward, a recognition that there have been recommendations in the past, and also I think a recognition that this would be a time to move forward with Pharmacare where previous recommendations have not necessarily been acted upon.
Make sure I don't misunderstand what you said there. Did you meet with the Minister of Health?
No, we did not meet with Minister Michel about the about our report. We understand that it was submitted to the minister's office and that the minister was briefed by her staff about our report and recommendations. But as far as I know, there aren't any plans for the committee to meet with the Minister of Health.
What does that tell you about the government's seriousness?
I think that there have been past recommendations that haven't been implemented, and I think what we've heard right now from this government is prioritization of other issues. I would make the argument that the threat of tariffs coming out of the White House indicate that this is the best time to implement Pharmacare. The extent to which Canadians lose their jobs due to tariffs and the extent to which drug prices are indirectly increases by tariffs on medicines will both increase the benefits of Pharmacare to Canadians, both in terms of access to medicines and lower prices. Right now, we're spending around $60 billion on medicines in Canada. If tariffs increase prices, that number could jump to something like 65 or 70 billion, whereas Pharmacare is projected to reduce spending by approximately $5 billion. So the stakes are very high. People's lives are at stake. And I would suggest that Pharmacare is an example of a nation-building project waiting for only the approval of the government. So this is something, I think, within the power of the Prime Minister and the Minister of Health to implement. There are recommendations, there are prior ones that should be acted on now.
Did anyone from the federal cabinet make time to meet with your group?
We haven't had a meeting with a cabinet member about our recommendations. We were pleased to meet with the former Minister of Health, Minister Holland, at an earlier stage in the committee's process.
I guess not to belabor this, but does it disappoint you that the government doesn't seem to want to engage here?
I'd be very happy if there were no more meetings, no more reports, but people got free access to medicines. We've spent a lot of time. We wrote a report that is, I believe, 79 pages long. It builds upon prior reports. I'd hope that it's clear. Of course, if there's anything that's unclear, we'd be happy to speak to the Minister of Health or other members of the Cabinet. But I think the first step that we recommend is new legislation setting out a framework for Pharmacare that builds upon the principles of the Canada Health Act. So that would be one indication that the government was ready to move forward if we saw movement on legislation. We also talk about creating a coherent national strategy on medicines. And I would add that those two steps, I would add that neither of those two steps require any immediate funding. Obviously, there is an incremental public cost to Pharmacare, but there are steps that a government could take right now that would help progressively realize the right to health. And the concept of progressive realization and recognition of the right to health means that it is fair for a government to say that there are difficult fiscal circumstances or there's these threats of tariffs, so perhaps Pharmacare could not be implemented fully this month, but real steps need to be taken immediately.
I know that you folks have put a lot of work in over the last year, and it's probably been a long time for all of you, but is your mandate complete now, or is there more that you plan to do?
The mandate as per Bill C-64 is complete, but as professionals, as those that have been involved, and particularly the intersection of my sector and their recognition of all of the elements of these recommendations that exist outside of Pharmacare. There are some very important strategies and very important planning and relationships that need to be formed so that we can actualize what this is intended to be and mitigate some of those risks that we've identified through the reporting process. I do believe that we will continue in our own spaces and together as a committee through our relationship, and looking forward to doing so for as long as it takes.
And Amy, you might be here as long as me. As you know, Sarah, this has been, for nurses, an issue of 30 plus years. We realize that every time a family doc, a specialist, a nurse practitioner gives a prescription, if a family cannot afford it, they end up back in the emergency room. And that's why we never gave up, and we will not give up. That's why the three experts are having a press conference today, because Minister Michel gave it to the House, as per legislation says, on the last day on Friday, and we needed to explain it. You have to realize that the C-64 asked us to give a practical plan, and that's what we did. If you would have heard my lobbying for 20 plus years, it would have been on a full Pharmacare program. This is talking about essential medication. And family doctors like Dr. Persaud convinced us that this is what we need. It covers about 92% of the prescriptions of everyday patients out there. And when we as Canadians and as healthcare professionals can't say that we will not provide the basic need of prescription medication, how can we say that we do have a universal healthcare system in this country? So we will continue. There'll be more press conference, more campaign. I think there's one starting right after the press conference, and we will just continue on.
I'll maybe add one more thing, which is that one of the recommendations is about annual reporting on, for example, the difference between prices for drugs paid through hospitals and community pharmacies. We know that hospitals win lower prices through competitive processes, and that's what we recommend for the public system. So we should continue to report on that differential, as the Auditor General has done before. We also report annual reporting to the relevant United Nations bodies on Canada's progress towards realizing the right to health here. The Government of Canada actually has reported previously on how steps related to Pharmacare represent progress towards the right to health. And so in terms of whether our mandate is complete, as Amy said, it is formally complete, but we'll continue to support that annual reporting and could be back here, for example, a year from now to talk about what progress has been made.
I think that's it for me, guys. Thank you so much.
Thank you. Thanks, Sarah, for all your reporting on this and for your questions today. Appreciate it.
This concludes the press conference. Ceci conclut la conférence de presse. Merci.
Merci. On peut prendre une photo en